Hello, and welcome to Improving Biotech Pharma Program Management Across Functional Teams. My name is Robert Happing. I'm the Managing Director of the Biotech Pharma practice at OnePlan. I'm here with Sean Kim, who is a Senior Account Executive and part of the Biotech Pharma team as well. I've been implementing project and portfolio management solutions in the biotech pharma space for over 25 years, and I've had the privilege of working with both large companies and small companies in the biotech pharma space, and have used all kinds of different tools and published articles and books. I presented at the DIA, etc. And so here to share all that experience with you and really focus in on how OnePlan can help you optimize your portfolio and program management in the biotech pharma, in the managing key development programs. Sean, I know we've been recognized as project and portfolio management experts in this space. Maybe you can give us a quick overview of how that looks for us and how we work with Microsoft and so on.
Sure, Robert. So yeah, OnePlan is a very, very long time Microsoft certified partner, but especially in recent years, we have been awarded and recognized by Microsoft as the Global PPM Partner of the Year 5 years in a row. And this recognition really speaks to the value that we can bring in terms of the solutions and the services that really solves for the challenges and needs that some of our clients around are having around project portfolio management or strategic PPM, or for this audience especially, a solution specific to the biotech and pharma use case. And it's not just Microsoft. We're also recognized by analysts like Gartner and Infotech and Forrester and others as well as a leader in the project and PPM space. And with that, back to you, Robert.
Thanks, Sean. That's great. And we do provide consulting and advisory services in this biotech pharma space, and we offer implementation services. We have great education and training programs and a great online academy that can be tailored specifically for your needs. We have great customer success and support and advisory services. I spend all my time helping to set up global program and portfolio management and alliance management offices, putting together integrated program plans and dashboards and visualizations. And so I spend a lot of time in this space. And it's really all about choosing the right projects, the strategic portfolio management piece, and then the project management piece, and tying that into your portfolios, and whether you organize your portfolios around franchises, therapeutic areas, disease areas, or assets or molecules, and strategically organizing them so you have programs that drive to an indication, and then going through discovery all the way through phase 1, phase 2, phase 3 submission and launch, and then working within the different functional areas in there, whether it be CMC, non-clin, clin, regulatory, just to name a few. And putting that all together is no easy task. And OnePlan offers a really great solution for that. I think what I found working with so many organizations over the years, some organizations are really good at the portfolio piece, and it's a different audience. You're talking strategic level, leadership level there, trying to determine where to invest time and resources and dollars to select the right projects. And they do it well, and some organizations do the project management well, managing their integrated program plans and their work down at the team level. But a lot of times it's disconnected. And getting those in one place and doing them both well at the same time can be challenging for organizations. And then tying those to corporate goals. We have a great goal tracking tool and a great goal management system, whether it be corporate or quarterly goals or objectives and key results. Then managing the timelines themselves, whether it be by development stage, which we all want to look at it by development stage. What stage is your pipeline in, is your development program in, from discovery to right through to registration and commercial launch, and how do you manage those? So we're going to dig into that today and look at how we're going to organize that, and whether you do it by development stage or functional area or some hybrid of both, because typically we want the sub teams to manage their components but feed into the development stage areas that they're working on. And then which tool are you going to use? Today we're going to look at OnePlan. But one of the nice things about using OnePlan is you can still use Microsoft Project and pull that data in, or if you want to use something like Smartsheet or some other scheduling tool, you can do that. Then, of course, having everything in one place, we can start developing consistent reports and statusing, and as well as lighting it up with dashboards and analytics. So we'll see all that today as well. And then we have a really cool one plan modeler scenario planning tool to allow you to do what if scenarios, or look at your clinical development programs and say, what if we shift things around, or can we expedite one clinical approach over the other, and how does it impact our submission date, or how does it impact our finances or our resources? So we have a modeling tool we can look at, and that's kind of a nice thing to have. Key here too is that at the end of the day, it's nice to get everything in one place to start generating the information and dashboards that you need. And one nice thing about one plan is we have one connect that can integrate things like Project or Smartsheet, but even financial tools or Oracle, ERP systems or SAP, whatever other tools you're using, we can bring that data into one place, so we can start to light up the meaningful dashboards and get information there for better decision making. So at this point, let's go take a look at one plan. I'm going to start off here. This is the actual one plan tool. And over here on the left-hand side, we have different icons, and they really represent different modules. This view you're looking at is what we call the portfolio view. And in here, you can organize your portfolio any way you need to. This is just an example. And we actually have a solution type template that you can start with from free. So at the end of the presentation, we'll tell you how to get that going. But this is just an idea of how to organize it. It can be by therapeutic area. This could easily just say, franchise, or it could say disease area, or it could just be asset. Maybe you just want to look at it by asset, and then you get down into program and function plan, and you can have program, you can have sub project, however you want to. And this hierarchy can be tailored specifically to meet your needs. So this is just an example of how this can be organized. So very configurable on these plan types and how to structure this. And of course, you can just click on plus and drill down into the different levels. So I can see my therapeutic area, my assets, my functional plan, and then you can have your program plan. And then across the top, you can have different fields, all of which are very configurable. This is just one idea of how to present the information. And if you want to light up your Gantt chart, you can, and you can see your Gantt chart. You can even have rolled up milestones that perhaps show, like, first patient in, last patient out, etc., depending on the type of program that you have. You can even load up from here your resource plan, so you can see how your resources are being utilized across the different projects. And these resources can be generic or named resources, but it can start to tell you whether you have any red areas or not. You can see there's either hours or FTE, depending on your needs. So you can also load up your financials here too. So if you want to see if you're managing any financials, or managing to a budget, you can load them up here. And we'll talk about modeling a little bit later on, but you can certainly start turning projects on or off in our modeling tool to see how it impacts your resource usage, etc. So those are just options, to give you a high level view of what's going on at the project or the strategic portfolio level. You can also customize the views. So for example, if I'm more interested in organizing this by functional plans, I can click on, hey, let me display all my project information by functional plans. And again, you can light up your Gantt chart if you want, turn that on or off anytime you need to. And maybe you're like the CMC manager, or I'm in charge of clinical. I can simply have a view here just to show me all my clinical plans. And maybe I'm the lead of that functional team or that department or that group. And again, I can light up my Gantt charts. I can show my resources. Just, hey, these are the resources that I need to manage my clinical programs. So what a great thing to be able to do as a manager of the clinical group or clinical operations. And then of course you can drill into the details, and that's what we're going to do next. Or maybe you're the CMC manager. You can do the same thing. Just show me my CMC plans. Or maybe you want to see what's going on with regulatory. So you can have these different custom views, and it's really quite easy to customize these views, and then just click on save. And you can make a view a personal view. So maybe you created something for yourself. Of course, this tool is all very permissions based, so you have to permission to do this, but And so some people will be able to do it and some people won't, depending on how you want to set up those permissions. But I can have a personal view, just call it Rob's view. No one else needs to see this. Or you can create something as a default view. So very, very simple. The other thing I wanted to talk about, again, at the strategic portfolio level, is it's it's important to try and put in some tools to help you decide what your priorities are for your project. And one of the things that we have built into this tool is the ability to put in what we call business drivers. And then you can customize these based on your needs. But for example, we have one called medical need. We have one called scientific feasibility. We have one called clinical feasibility or innovation opportunity. And each one of these is going to have an impact value. And it's going to be extreme, strong, moderate, low, or none. And what we suggest you do, and we help you do it, is, and we have plenty of examples, by the way, is put impact value statements associated with each one of these. So you know what extreme, strong, and moderate is, and low. So you take the guesswork out of it. And as you change your scores here, you'll notice the prioritization scores change over here. So it really helps take the guesswork out of prioritizing your programs. And you can do this, at the functional level, or you can do it at the program level, or whatever level you want to. And then you can load up budget and benefits and start making better decisions. And later on, we're going to talk about this modeling tool to show you how to do what if scenarios, whether you want to, pull projects in, pull projects out, or move them in or out to the left or right, and look at your resource and budget constraints. And again, you can load up your resources here as well, just by clicking on that and see what that looks like. This set of projects and what do we have enough resources to do it? And, red means maybe not, green means maybe yes, and so on. So we'll talk more about that when we get to the modeling. But I just wanted to show you that we do have this project prioritization functionality built right into the tool. So not only can you dig into the details of managing the schedule, but you can look at it from a portfolio standpoint. So everything's in one place to be able to do that. We also have the ability to look at what we call a roadmap. And in here, you can see your roadmap either by functional area, or you can look at it here by therapeutic area, and you can change that. You can obviously change the, whether you want to look at this year, next year, the next 5 years, etc. And also, you can customize these roadmaps. So maybe I want to look at it by development stage. So I can see, hey, these are all the things that are in phase 1. These are all my programs in phase 2, and so forth. So it really gives you the ability to see the big picture and what's going on across your programs. We do have dashboarding capabilities. I'm going to get into that a little bit later. But at this point, I want to dig in to the details of how are you going to be managing these integrated program plans, and how are the team members going to be interacting with the tools and the sub-teams, etc. So I'm going to go back to our portfolio summary view here real quick. And I'm going to drill into, say, one specific area, maybe oncology, an oncology small molecule. Now, here you can see I've got the oncology program plan, and this is the integrated program plan. And that could represent just one indication. So you can have one program plan, or you can have multiple indications inside of that. But that's the idea. You've got an indication in here. I can also have functional plans. So I've got a clinical plan, a non-clinical plan, etc. So if I click on the oncology integrated program plan, and I go to details first, so I'll start there. You can capture project metadata about this project or this program. You'll notice across the top, we have this process defined. This is our development process. This is highly configurable. And Sean, I think we can also, expand on that with workflows, for example, or Power Automate workflows. And you probably know more about that than I do.
Sure, Robert. Yeah, so every organization has a different set of processes or workflows that they would like to model or track, right? So the one plan gives you the power of choice. It is a very highly flexible tool. So you could model your stage gates or your stages and phases here directly in the tool. But then you can also link it to Power Automate on Microsoft Power Automate. So if you do have sort of a more complex approval process where you need to get signatures or you need things to be routed in certain ways depending on certain conditions or criteria, we can do that as well with Power Automate and one plan.
Yeah, and that makes it really flexible in terms of how you set up and configure this tool to meet your exact needs. And the same thing with what you're looking at here. This is just an idea of some of the project fields, but all of this is configurable. Whether you want to put a business case in there or not, or capture some financials, you don't have to. Health, you can have accomplishments, planned activities, etc. So this details page is very configurable, and it can change as you go from one phase to another as well. We also have the ability to capture financials. So you don't have to use this module, this capability. A lot of these things can be turned off, but if you want to track your financials in here, you can, and you can do it at any level. You can do it at the therapeutic area level or the asset level or at the program or function level. So you can capture financial information, and this is all configurable. These labor can come in from your schedule if you want, or you can just build in labor costs uh, at the project level. You can these are all, you can have bulk drug supplies, you can have patient cost, you can have all kinds of different costs in here that you track over time, and again you can sort of look at it, this year, next 5 years kind of stuff. You can also do resource planning. Now, resource planning is kind of flexible in this tool. You can do it at the project or program level. So keep it very high level and just say, hey, I need a clinical study manager. And by the way, this can be looked at by hours, percent, or FTE. So you can flip back and forth quite easily. So if like in April of 23, you need to have a clinical study manager and I need 100%, you can just start adding in that time here, and you can add resources just by clicking on plus and so forth. So the resource planning at the project level is quite useful here. And that's a lot of people just get to that point and go, that's great, that's all I want to be able to do. But we also have the flexibility to go into the work plan, and I'm going to dig into the details here. And to me, this is kind of where, and these are risks, I'm going to go to the schedule. This is kind of where the rubber meets the road. This is where you start building your work breakdown structure, or your structure of how you're going to manage your program plan, and whether you're going to organize it by development stage. And again, this is just an example. You can call your stages differently. I know 1, 2, and 3 are kind of common, but preclinical to IND, you might have a discovery stage, etc. Or you might want to organize it by functional area. And, for example, CMC could be managing their piece, non-clinical can be managing their piece, and so forth. Or you can have a hybrid. In this case, this is really a hybrid example. So if I get into my clinical program here and I look at my phase 3 stuff, and I look at study conduct, you can see I've got different types of tasks being displayed there. And then of course I can show my Gantt chart, and you can start visualizing the timing of that. And then if someone's managing this clinical program, we can actually have it link up to the stage level here. So you can actually just expand that particular piece of the puzzle, go into your clinical program, and you can see here that these links are coming up from the actual clinical study being managed by the clinical study manager. So it allows you to do a hybrid and integrate across the plan. Well, here at this point too, you can also do your resource assignments. So if you want to assign resources here, you can, and that's more down at the task level. So you have your choice to assign resources here or at the task level, which feed up into the resource plan, or just do it at the project level, which gives you the flexibility to do that at any level of detail that you want. And you know what? One plan has some very nice scheduling capabilities. You can obviously expand and collapse your work breakdown structure. You can indent, outdent. You can create your links. So I can click on my resource button, and if I want to assign a resource to a task, I just simply click and drag it over. Yes, you can get into details if you want, and put in units and hours, and you can get as detailed as you want, but you can keep it simple as well. Putting in percent complete is no problem. I think you can just type in status. You want to just call something done, in progress, or if I make this 100% done. So it's very easy to interact with, and it updates accordingly. So you can put in the information you want, do some basic simple scheduling. You can create filters, you can have custom views. Maybe you just want to see your milestone view, and just have a quick milestone view of what's happening with your project. So you just see the milestones across the entire project, and if I expand all that, you can see that all the detail. And these are just all milestones that you have here. I'll turn this off for a second. And again, light up the Gantt chart if you want, and you can see these are just all the milestones I have in my program. And so all the basic functionality is here, but if you need more, or if you want to organize your project in a more robust scheduling tool like Microsoft Project, you can. And here's just an example. Same concept. You have your integrated program plan, and this is an example of doing the hybrid approach where you have a development stage here, and then we just have a one plan add-on, and you can publish your plan back into one plan so it shows up there. And Sean, I believe we can also create scheduled activities so this happens automatically.
Yeah, so there are some settings that are available for you for the I guess the timeline of the synchronizations. So you could set the schedule so that it synchronizes on an hourly basis or on a daily basis, or you can always do a manual sync whenever you do need to do that.
Yeah, that's great to have it. So you can have a scheduled or hybrid. And by the way, you can choose how you want to organize your plan. This is just one example. We have plenty of templates, and we have a lot of templates that come with our solution offering type to get you up and running fast. But here's one that's just organized by development stage first, and then you have your functional plans underneath each development stage. So you kind of repeat it that way. And then here's one that's simply just organized by function. And then you have some sort of key program milestones and decisions on top. So, here you have your CMC activities, expand on that. You have your clinical activities and so forth. And these can all be projects or sub-projects depending on how you organize it. So plenty of ways to do that. So it's kind of nice. And we have a sync button here, so it shows you what connected systems you have. And it doesn't have to be Microsoft Project, could be Planner, could be Modern Project for the web, or it could even be Smartsheet, or it could be a mix of many things. So if you don't want to use one plan as a scheduling tool and you need something more robust or like Project, go ahead. But one plan gives you some great flexibility in how to do that. And on top of the schedule, folks, we can also create other items associated with it to give you a one-stop shopping place. So for example, we could add in goals here. We can add in risks, issues, changes, decisions, and lessons learned. So if I go into, say, my risks log, I can. Let me just save my plan first. And, these are all configurable as well. Just keep that in mind. So if I go into my risks log here, it's going to load up my risks. And this is just an example. And again, our templates come with some pre-defined fields, etc. But you can configure these to the way you want to do risk management. So here we just have a name, what the status is, slow enrollment, at risk, mitigating. You can have other things in here, but the good news is you can assign people to this, and also attach them to tasks if you want. Same thing with any of these other components, and then they're all reportable. So I'll show you later on. These will all show up in a dashboard. Even lessons learned. We all know what happens when you do a lessons learned event. It ends up in PowerPoint and gets parked in a folder somewhere. No one ever sees them again. But if you actually capture them in the project, then we can have lessons learned reports, and we can keep track of them in this data set. So better chance of quick and easy access to that type of information. So you get that all in one nice place. Sean, I know we've got other things in here, but these are highly configurable, and you can add other types of items in here as well, eh?
Absolutely. So yeah, again, this is a very flexible solution. So we have seen many customers use the ones that we have out of the box, and maybe they'll add some additional fields or modify some of the options for those fields. But then they also do add some of the other columns or some of the other activities or work items that they would like to track as part of the project. And as Robert mentioned, it's all goes into the database, so it's very reportable. You can track against it. And then you can even leverage AI for all of those items as well. So you can really get value when you're leveraging all parts of one plan.
Nice, yeah. I really like that, having it all in one place and being able to collaborate as a team. We also have some reporting capability here. We're going to talk about dashboarding too, which is to me the pot of gold at the end of the rainbow. But we have status reports, and these can be set up on a schedule too, Sean, or you can submit to these reports.
Yeah, so you can create those reports, status reports, anytime you'd like. The thing I like about the status reports is that it takes a snapshot of all of the metrics of the plan at the point in time, but it also gives you a place for you to add context for that status report. So it gives you a place for the owner to go in and say, hey, this is the reason why it's showing green, or why it's showing yellow, or why it should be red. And then you capture all of that in a status report, and you can always go back and refer back to the older status reports. And all of those snapshots that get taken are used for the trending analysis as well. So you can see sort of the trend of the project or the plan as it progresses through time.
Yeah, I really like that as well. And we have insights. Essentially, you get access to your dashboard here. So some really great functionality that we have in there. So getting down to and just to show you how easy it is, like I just have some placeholders down here, how easy it is to add a new plan. You just click on new, say I want to add a new program plan or new function plan. I click on new function plan, and let's just call this my new Clin plan 2, or you name it, phase 2, that kind of stuff, and just add a plan. And then down here, you can see I've got Clin plan 2 here. I can click on the details here. And again, you can go through and fill out all the details, the financials, resource plan, or not. And you go to the list here. Now, one of the other nice things I like about using one plan is that we can create a nice template library. And you can insert those templates into existing plans or brand new plans like I have here. So if I just go to the, this hamburger over here, and I click on insert templates, you'll see that I've got some loaded up here. And in our solution type, we have a whole bundle of templates for clinical, CMC, regulatory, IND, NDAs, non-clinical templates, etc., that we offer for free as part of our package. Here is a clinical plan. So we have short versions of the clinical study. We have long versions depending on your needs. So lots of different templates to choose from. And I click on next. And this is going to load up that template, and it's going to just say, hey, you got this template, make sure you save it. I'll just save it just so I have it, send boot, and then I've got my study template. And you can just change, if you want to, you change your project start date here, and it could reschedule automatically. You can come in here and look at what's there. You can see it, you can see it in the Gantt chart, of course. Maybe you change your enrollment period. Hey, this is longer than 3, it's going to be like a multi-year thing, so you just change it. Hopefully, you got your dependencies and everything all set up, or not, and you can just change this to be whatever you need it to be. And you can go into manual schedule mode or auto schedule mode. We have quite a lot of advanced settings. You don't have to take advantage of them, but we have quite a lot of advanced settings for effort-driven, manual versus auto, etc. But it's that simple. And if I want to add new tasks, really easy. Let's go here, add task, add task, add task, and I can come in here and put in 10 days, 10 days, 10 days, or 190 days, or 10 days, or whatever. And then setting dependencies. You can just do your basic scheduling stuff in here, where you highlight these 3 tasks and set your dependencies, and it creates your dependencies, etc. And again, if you want to start assigning resources, you can just start, putting resources. A very simple and easy to use scheduling tool, just with the basic functionality. But what I really like is the ability to, now if I want to add another maybe you're building a clinical study template, you can just insert another study and another, so you can just use that insert template functionality, which I think is great. And Sean, I know in our Biotech Pharma solution, let me just save that first. I've put in a whole series of templates, not everything we own in terms of templates, but definitely a starting point. But we have you can create personal ones just for yourself, and then we have the online ones. These are ones that were provided by us, so maybe not applicable to Biotech Pharma, but quite a few ones in here, eh, Sean?
Yeah, I mean, there's so many different templates to get you started. Admittedly, for a enterprise organization, some of these more generic templates you probably wouldn't use just straight out of the box, but they are great starting points if you do need a template that you already don't have. what I find most useful is that you already have a project that you've done, and you can use your old projects as the starting point for a new template. So that's also available. There's also import options where you can import either a CSV file. So if you've been, a lot of times folks manage plans in Excel, right? So if you do that, then you can easily import that Excel into one plan as a template, or you can import other templates as well. And then also you do see that AI tab there as, and it's too, and I played around with that. It's very easy to ask for a template for using Sophia and AI, and it will actually give you a pretty decent starting point for project templates too. So again, I think these are just great starting points. Unless you already have one that you've been using for your organization, then you can definitely reuse those. But yeah, all kinds of different templates to get you started, and there's different options in where you insert the template, whether it's at the end of the project or in the middle of the project. That's, you can actually even stitch together different parts of, or different sets of templates into a big plan as well. So again, yeah, many different options.
Yeah, I'm glad you mentioned Sophia. So one plan has AI built into its tool now, and Sophia allows you to ask questions or look for information or build things. And it's a great starting point with our AI tool. It's something to be turned on or off. You don't have to use it. And Sean, correct me if I'm wrong, but I believe it's just AI within the client environment. It doesn't go outside of that, so it's very protected, highly secure AI.
Correct. Yeah, it is. We are using, we built Sophia using the Microsoft Azure OpenAI. So it's not the open standard OpenAI that folks have maybe playing around with ChatGPT. So it is the more secure, has privacy built in as part of the Azure service. So we do leverage that for security purposes. And it is very useful. It's very easy to use. It's built within all parts of one plan. So no matter where you are, you can click that Sophia button, and we'll give you some suggestions or examples of what you can do with Sophia in that sort of context. But you can do things like, just simple things like augmenting data entry, or helping you get information, quickly. Or you can also do more contextual things like budget and resource optimization, or identifying risk in your portfolio, or even prioritization help as well. So I would say it's again, very good aid, very good tool to help you throughout your work.
Yep, it's good stuff. I really enjoy using it. Here too, by the way, when you're looking at your portfolio, when you see an indication like this, that tells me that that particular plan is being managed in Microsoft Project, and we've already talked about that and how it can synchronize. So if you have different icons, that's what it shows. So lots of flexibility. So I think having the ability to look at these things in one place um, gives you a better chance of being more effective across functional teams and having custom views and permissions, letting people access what they need to see just in time. Now, getting down to the ground level, we have this great area up here called Insights. So this is just for the person that's logged in. Hey, Robert, welcome back. We have the ability to have insights here. Some of them can be compliance related. So we can set up compliance standards so that, if you're in compliance or out of compliance, or something can just be general. You don't have to use that feature. But, for example, I have 6 overview tasks. Some of my project schedules are out of compliance, things I need to approve. So this is kind of nice to show me what's going on for me. Over here, we have recent conversations. There's lots of areas to put in conversations and notes and comments, etc. And we can set up alerts and reminders as well. And down here, these are all the plans that I've been associated with. So if I want to go directly to that plan, I just click on it. It takes me right to the work plan right from here. So the insight and things that are due soon. So it's kind of a nice little area, very effective for team members. And Sean, these are the kind of things that we can put in on our mobile app as well. I think we have a nice mobile app available for people to use where they can see their insights, and we also have the ability to manage my work. So this is great for me. These are all the things that I'm responsible for. Things that are overdue, for example, I better have a quick look at. And you'll notice over here, folks, it's not just tasks coming in from a schedule. It could be risks that I've been assigned to, or issues. I could have goals assigned to me, etc. So this could be like things that I need to be aware of. And I can simply come in here and either mark them complete if I want to, and then that can feed back into the risk plan showing complete, or if it's a task, it can feed back into the project plan, and maybe there's an approval process that the project or program manager has to approve it first. But it allows me to look at the things that I'm responsible for. You can look at it in various ways, and these are all configurable, like a lot of everything else. So you can look at my work, things that are past due, priority, etc. And if I want to look at it more in a Gantt chart view, I can turn that on or off. But Sean, our mobile app allows team members to look at and talk about being effective. You've got your portfolio decision making going on, different audience maybe not everybody sees that. Then you got your schedules and your work plans and your details and your statusing at the program or project level. And now I'm down here as a team member going, oh, these are the things that I need to work on.
Yeah, absolutely. So I saw an interesting stat recently where 50% of roughly 50% of corporate employees are not fully aware of everything that they're assigned to, that they even should be working on. So a lot of times they miss deadlines and they miss things because they didn't even know they were supposed to do it, right? So this gives you that one-stop shop where you can see everything, that all the different work items, not just tasks, but as you identified, issues and risks and other things as well, all in one place. And if you can get access to this in all in one place, that's great. If you can get access to it on your mobile device, even better, right? I don't even have to get to a laptop. I can just whip up my phone and see all the things that's due today or due tomorrow or due this week or next week or maybe overdue. Maybe I need to get to work, a lot quicker. So yeah, it gives you that one-stop shop, gives you easy access. It's really about giving you access to the data that you need to get your work done.
Right, at the right time. So that's a great point. Listen, I don't want to take up too much more time. Just a couple of quick things. We do have other modules in here. Again, these modules can be turned on or off, so we can try and simplify this interface as much as possible. You can track, your objectives and key results in here as well. And again, tie those to projects. So if I click on, my BLA submission here, and I want to go to reporting and visualize, and then look at my runway of, how that impacts, that BLA submission impacts some key results, and these are all the different program and functional plans. So we have quite a nice ability to track objectives and key results. And then also, I'll leave with, well, not quite leave with this, but I want to talk about dashboards as well. We can do what we call modeling. You can have clinical scenario models, for example, or you can look at your program, strategy prioritization model, for example, and maybe I want to. You can light up your Gantt chart here as well. You can light up your financials at the bottom if you want. You can change your view here a little bit, and then down here you can say, look, I've got a budget, and right now I'm over budget. And you're looking at your projects, and this is just an example. Do the same thing with resources. You say, what if I decide not to turn this? And again, these can be ranked by priority. So if I start turning projects off and moving them out, you can see, okay, if I move these projects out, how does it impact my budget? And you can see I'm getting close. I'm at 2.6. I need to get to 2.5. So if I start, depending on your priorities, you start moving things in and out, and you can see the impact of that. You can even shift things up here if you want to. I can move projects to the left or to the right, manually. I can type in dates manually, so you can sort of see the impact things have if you sort of shift things out by quarter or to next year. And then when you get to the scenario that you want to utilize, you can save scenarios. So I can have my base case, my worst case, my best case scenario. So we have quite a nice modeling capability. I don't have time to go through all of this. We have bubble charts and other visualizations to look at things and compare your scenarios, etc. So full modeling capabilities there. And then, a couple of quick things, and then we'll wrap things up here. We do have dashboarding capability. So you can come in here and look at dashboards. Now, this dashboard that you're looking at is really driven by Power BI. So a lot of times you don't even have to come into one plan. We can just have executives and leadership team members or other people who are interested in just looking at dashboard information go directly and point them to the Power BI, so they can bypass one plan altogether, or you can visualize it embedded into one plan. And these can be all customized and configured to meet your needs. Sean, I think our tool comes with a standard report pack.
Yes,
well.
We have a set of report packs, and they're all contextual as well. So you're looking at the portfolio dashboard here because we were in portfolio when I clicked that dashboard. But if you're in, let's say, strategy or resources somewhere else, and you click dashboard, you'll get a different set of that dashboards available. and you can see all the
Yeah,
different tabs underneath. There's so many. It
right.
pretty much covers the gamut of everything that you would typically need in managing a portfolio program.
And you can have slicers across the top, so you can, group by program, whatever it is. So these are all configurable. So for example, I go to program details. I can see an overview. I can click on status. Click on financials. You don't have to use financials, but if you are, it's great. Execution, where you can have milestones. You have timeline type visuals in here. So it gives people the chance to consume the data. And again, once you get all your data in one place, in one plan, we can source all that and create these nice dashboards for people to use. So that's on that note. I think what we'd like to do is just suggest, hey, what's next for me? The good news is we have a Biotech Pharma PPM solution template for free, and you can try it for free at oneplan.ai/trial. So you can use that organization. But Sean and I would love to set up a more detailed, deeper dive demonstration to meet your exact needs anytime. So what we suggest is give us a call, reach out to us, email us, contact us anytime. So I want to thank you for listening to our presentation today, and we look forward to sharing our success with you. And feel free to contact myself or Sean anytime. And thank you very much, Sean, for participating with me.
Thank you, Robert. Thanks,
Have a
everyone.
great day. Yep, thanks. Have a great day.